Well, good morning, everyone. My name is Brianna Romines, and I'm honored to serve as president for the Epilepsy Foundation of Michigan. And it's my pleasure to welcome all of you to day 2 of the Upper Midwest Rare Epilepsies Conference, presented by the Epilepsy Foundations of Greater Chicago, Michigan, Minnesota, and Wisconsin. As many of us know, there are 3.4 million people diagnosed with epilepsy in the United States, and 1 in 26 people will develop epilepsy in their lifetime, with an increasing number of people being diagnosed with a rare form of epilepsy. Though advances in research and genetics are resulting in an increased understanding of many of these syndromes, there is still much to learn. These rare forms of epilepsy can greatly alter a person's life, and the more we understand them, the better equipped we are to address the challenges that they can present. Now, yesterday's presentations focused largely on research and therapies, and today we'll shift toward exploring the impact of rare epilepsies on day-to-day living and quality of life. And we'll discuss some of the key considerations in planning for the future. We'll also have some time to address a variety of other topics in our Rare Epilepsies Open Forum. Before I introduce our first session, I want to thank the Rare Epilepsy Network for helping us plan and promote this conference. The Rare Epilepsy Network, or REN, works with urgency to collaboratively improve outcomes of rare epilepsy patients and families by fostering patient-focused research and advocacy. REN includes over 70 rare epilepsy organizations and broad epilepsy stakeholders, including the Epilepsy Foundation, committed to this common mission. So definitely take some time to visit their website and learn more. Now, I'm very pleased to introduce our panel of speakers for the session entitled Supporting Physical, Mental, and Cognitive Health in Epilepsy Care. Dr. Jana Jones is a neuropsychologist from the University of Wisconsin-Madison. Dr. Sucheta Joshi is a pediatric epileptologist from Michigan Medicine C.S. Mott Children's Hospital. And Dr. Yssa DeWoody is the president and co-founder of Ring 14 USA and a parent of a child with a rare epilepsy diagnosis. Together, they'll discuss the importance of integrating physical, emotional, and cognitive well-being into epilepsy care decisions. Before we get started, Russ Derry, the Director of Education at the Epilepsy Foundation of Michigan, will go over some housekeeping tips for using this Zoom webinar platform. Russ?
Thank you, Brianna, and welcome everyone. Today we'll be using Zoom webinar, which looks a little different from a regular Zoom meeting. As an attendee using a computer or smart device, you'll only be able to listen and view the presentations. We can't hear or see you. At the bottom of your screen, you'll have the option to chat or use the Q&A feature. Please use the chat feature for any comments you'd like to make or resources you'd like to share that relate to the topic being discussed. And make sure that your chat is set to all attendees and panelists so everyone can see your comments. If you think of any questions during the sessions, please use the Q&A feature and we'll do our best to answer as many questions as possible at the end of each presentation. As an attendee calling in from a telephone, you'll only be able to listen to the presentations. Okay, so let's get started with our first session, Supporting Physical, Mental, and Cognitive Health in Epilepsy Care. Okay, let's make sure all of our panelists unmute themselves and show their smiling faces. Okay, Dr. Jones.
It says my video has been stopped.
Oh dear. Can someone, I believe someone.
It says the host has stopped it. Yeah,
the host should be able to ask you to share your video.
Okay.
There we
go.
Hello.
Right.
Look at that. We're all lined up nicely on the top too. Okay, so can we start by having each of you briefly share a bit about your background, your interests, and your experience with this topic? Dr. DeWoody, do you want to get started?
Sure. So like Brianna said, I am the co-founder and the director of Ring 14 USA. So we advocate for a very rare syndrome called Ring 14 syndrome. And that is a structural variant. So it's a chromosomal issue. So a little bit more complicated, the genetics, than the normal not the normal, but the rare monogenic syndromes. And then I'm also had the pleasure of being in the chair of REN, which was introduced also the Rare Epilepsy Network. But most importantly for this panel, I'm the mother of 3 daughters, and my youngest, Marie, just turned 16, and she is my daughter who was born with ring 14 syndrome. And so I'm going to kind of bring the perspective of how this affects the whole family, and my other daughters and the husband, because epilepsy is one of these syndromes that really does affect the family unit. And this is really true with the severely impacted individuals. And also, I just want to mention that I have a sister who has partial complex seizures that sometimes generalize into tonic-clonic. And we just recently, my oldest daughter has started having these. So there's something else running in our family, but it gives me the perspective of the profound and the rare, but it also gives me the very different perspective of how epilepsy affects adults and the differences in how those two interactions work. So thank you. It's an honor to be here.
Thank you for joining us. Dr. Joshi.
Good morning. First of all, thank you to the Epilepsy Foundation, Russ and Brianna, for inviting me to be part of this panel. I am at the CS Mott Children's Hospital, which is part of Michigan Medicine in Ann Arbor. We were formerly called the University of Michigan Health System, but now are known as Michigan Medicine. And I am one of the group of pediatric epileptologists in the Division of Pediatric Neurology at Michigan Medicine. I take care of a lot of children with all forms of epilepsy. And being in a medical center and a children's hospital like Michigan Medicine, the rare epilepsies are really not so rare in my practice. And I really hear what everybody is saying today about the impact that these epilepsies and this group of disorders, if you will, have on a child, on the family, on their milieu and everything around them. So one of the things that I try to do in my practice is not just update prescriptions and pick medicines and read EEGs, which I do a lot of, but really try to think of the child and the family as a whole and treat them all. I like to think of myself as a team member for everybody, whatever is the name of the child. And I really like to take this as a team approach in treating their epilepsies. So with that perspective, I'm really delighted to be part of this panel to share and answer questions, but also to learn from everybody. So thank you again for inviting me.
Great, thank you. Dr. Jones.
Hi, thank you so much for inviting me to come today and to participate in this conference. It's a really unique opportunity, especially to have all of these states represented in the Midwest. I'm at the University of Wisconsin in Madison. I'm a neuropsychologist. I've been working in epilepsy for a number of years now. My primary interests are in comorbidities, so cognitive difficulties, problems with depression and anxiety. And I also started out in the field working with folks who had more complex problems and developmental disabilities, and working with families and trying to see how to integrate people into the community. So hopefully we will have some good suggestions and be able to have a good conversation about well-being.
Okay, great. So because difficulty achieving seizure control is common among those with rare epilepsies, it's understandable that seizure control is a primary objective of the epilepsy care team. But to individuals with rare epilepsies and their family members, the impact of epilepsy and its treatment on physical, mental, and cognitive health can be equally, if not more important. Can each of you talk about the importance of open and ongoing communication about goals and priorities between patients, caregivers, and the epilepsy care team? And let's just go in the same order that we went. Dr. DeWoody, do you want to go first?
And I'm going to have to start off all of these questions. That's a lot.
Okay, I can mix it up.
I'm teasing. this is such an important topic because as your child goes through, being diagnosed and you're really in the heat of it, and then as your child grows, in the rare epilepsies, sometimes it's the comorbidities that really take over. And so this open communication between you and your caregiver is so important, because sometimes it's the other issues that rise to the top, like GI issues or sleep issues or all of these different things that really impact your life. And more importantly, sometimes it's the open communication between you and your spouse. So it's no secret how high the divorce rate is among the families with special needs. And in particular, and I think some of that strife comes from the fact that parents have different ideas on how to care for their children and the stresses of that. And so I'm sure that there's many different strategies to kind of combat that. But one of the things me and my husband have found is that when we disagree, and we both are opinionated people, and we are both highly invested in her care because we treasure her so much, is that we kind of take when we disagree, we try to go with the most conservative path. And so just kind of knowing how to navigate that beforehand when we go into discussions of care, it has been really helpful in our relationship, in realizing also that our daughters are really impacted by her care. And so their opinion is important. They're not the person who makes the ultimate decision, but they want to be heard, because her care impacts their life as well. And that was especially true when they were younger. And so this communication and just being really honest about what your goals are. And sometimes it's seizure control, sometimes it's crisis control. And sometimes there's fatigue in trying to try a new thing, you know what I mean? And the constant, and so we have to give grace for that as well.
Great. Dr. Joshi or Dr. Jones?
Here, I can go next, if we are sticking with the order. I think Dr. DeWoody highlights some very important points that should be central to the management of epilepsy for any child. And I cannot emphasize enough the importance of open and ongoing communication. As I just said when I introduced myself, it really is like a team sport. There is the child with epilepsy at the center, and there is everybody around the child talking to each other. We also have to remember to talk to the child while we are having that conversation, because while we all talk about seizure control, the next best medicine, the next best treatment, I think sometimes we have to take a step back and see where does that fit in the big picture. And the only way to do that is by open communication. I've always maintained that writing a prescription is the easiest thing I do in my practice. And if that's all that I did, I would see patients in and out in 10, 15 minutes, but it's really not about that. It's about taking everything else into account. Yes, we started a new medication, but the outcome of that has been, this child is falling asleep in the classroom or is not able to attend school. And, was that the goal of what we were doing, or are we trying to balance quality of life and education? So I think, and unless we talk and communicate openly, we are not going to achieve those goals. And things may look different from one family versus another. Just to give an example, when we talk about things like vagus nerve stimulation, if there is a child for whom being in the class, participating in, let's say, some sort of classroom activity where there's a lot of talking is going to be challenging, and the voice change associated with vagus nerve stimulation can be a barrier, that needs to be taken into consideration when you plan these treatments. In many of the rare epilepsies, the ketogenic diet is a fairly advocated treatment, which us epileptologists love for what it can do for a child's epilepsy, but sometimes it can have a massive impact, not just on the child, but on their family as well. And again, when we take this team approach and we communicate with families, it's very important to share all those things. And I guess what I'm saying is to listen. That really is the key when it comes to that open communication, so that you have goals and everybody sharing those and everybody knows what each other are talking about. The last thing I'll say is we see patients, we say our children in our clinic for half an hour, 45 minutes every so often, but their families are with them 24/7. So the perspective that they bring is, I think, is a very important factor in this open dialogue and communication. I could go on forever and ever, but I'll give Dr. Jones some time also.
Yeah, just to kind of build on that, I think one thing to remember is that each family's goals and priorities shift over time. And sometimes families can feel frustrated that they're not being heard or their needs aren't being met. And I think because the goals and priorities shift over time, it's good to have another discussion. And if the frustration can be an indicator that discussion should occur. And it's not necessarily that the medical providers are ignoring the needs of the patient and the family, but maybe they're not sort of up to speed on what the current priorities are for the family and the child. So I think remembering that too is to kind of maybe start off with that discussion, revisit what the priorities are, revisit what the struggles can be, and kind of get everybody on the same page again, because things may have changed in the last 3 or 6 months since you were into your appointment. And I think it's good to kind of refresh, see where we are now, see where we want to go, and sort of what the long-term and short-term goals are for the care currently.
Right. Well, great points. So one theme that often comes up in shared decision-making about epilepsy care is the concept of risk. Each partner in the epilepsy care team may have a different risk tolerance and may prioritize safety versus independence and quality of life differently. And that influences a wide range of decisions, including whether or not to wear a helmet, what activities to participate in, what living situations might be possible, how aggressive to be in the pursuit of seizure control. Can each of you share an example of a situation where risk was a factor that had to be carefully considered and negotiated in an epilepsy care decision? Dr. Joshi, do you want to go first? Ooh, look at that, mixing it up.
Okay. So absolutely, I think this is central to shared decision making. Absolutely. I'll share an example. This is not necessarily a rare epilepsy as identified by a genetic condition, but it is certainly something that I think impacts all of us in our decision making situations. So, as I just mentioned, we often use the ketogenic diet as a treatment modality for several epilepsies. And while this can be very effective in treating seizures in some situations, it is not something that is as easy or as, it just takes a lot of time and investment and discussion. And there have been situations where, on one hand, as a physician, I have felt like this is the treatment for this child. But then when I look at it from a family's perspective, like, why is this treatment not working? It really is a huge barrier for quality of life for what this child and family can participate in. And to the point that it actually became a negative situation for treating this child's epilepsy. And so while we were sort of in hot pursuit of seizure control, and I would say we did achieve good seizure control, the side effects, if you will, of the treatment that we prescribed, the those side effects completely outweighed the benefits of the treatment. So I think we had to all take a step back and say, what are we doing over here? What are we treating? We had to think up a plan B for treating this child's epilepsy. And, we were able to come up with a plan B that provided good seizure control. But at the same time, we were not blindsided by the fact that, this is the treatment we know, this is the treatment we're going to go with. And I think in that situation, we definitely had to, the risk that we were running into over here was extreme depression around the diet, extreme anxiety over situations, and that became a risk that had to be taken into account, that the child and therefore the family's mental well-being was just as important as keeping this child's seizures under control. So again, I think it's very important that you take all these factors into account every step of the way when you're making treatment decisions.
Okay, great. Dr. DeWoody.
Sure. I love this idea of risk and what you're comfortable with and what the family is comfortable with. And I think that this is one of these things that changes over time. And so, just from our perspective and what I've seen in our community, sometimes this tolerance for risk changes. And so when you're newly diagnosed and in the heat of the moment, your tolerance for risk kind of is low. You stay at home, you isolate, you try to do everything you can to get these seizures under control. And then as you grow more comfortable with care, you realize that the whole family has to live. And from our perspective, we had an increase in our tolerance for risk because we wanted quality of life, not only for Marie, but for ourselves. And so I'm asked all the time, do you travel? And this is something that is very individual for each family and for, they have to negotiate these terms. And, my answer was always have diastat, will travel, because I realized for us that we had to assume a certain amount of risk in order to live our lives and to have quality of life amongst ourselves. And so that's one instance where that's something that my family really enjoys to do, and we were not willing to kind of give that up. And furthermore, if we stayed home, she had seizures. If we traveled, she had seizures. And so that was just a risk that we kind of tolerated. But with regards to this mental health, and I'm just going to throw in my older daughter just for a second, is that as these patients get older, and my daughter is a young adult now, that I think we have to have a real respect for their tolerance of risk, because one of the things that I've seen is that she needs her independence, and I can't let my fear interfere with her ability to live her own life. And at some point, it's not my tolerance for risk in that case that's really influential. It's her tolerance for risk, and I have to be respectful of that, because her control over her life very much affects how she deals with her condition, and it empowers her when I give her that ability to choose her own risk and to respect that. And so I really appreciate the physicians who I don't know, who are just very sensitive to that fact that families have different levels of risk. Individuals have different levels of risk, and it is their life and their choice, and we have to honor that.
Great. Really, really important comments. Dr. Jones, any thoughts?
So that's a perfect segue to my story that I wanted to tell you. It basically centered around some discussions with a family and the daughter who had epilepsy, and also an intellectual disability. And the discussions were primarily about independence and risk and failure. If the freedom went too far, what would happen? And so we had lots of discussion about this, and we had one of the discussions was to leave this particular patient at home alone after school before mom got home. And so we sort of talked back and forth about what to set up for safety precautions and how much time was the kid and the mom okay with the kid being home alone. And so they practiced some different activities and set it all up. And I got a phone call from mom a couple of weeks later, and she was kind of laughing. And she said that they tried it, and the daughter decided to pop popcorn before mom got home. And she burned the popcorn and she burned up the microwave. And I was like, oh no, are you all right? Is everything all right? And mom laughed and she said, you know, it's okay. It was great. All we have to do is buy a new microwave, but everything went well. And now she knows what the parameters are for popcorn. And we bought a better microwave where you just push the popcorn button. And she said, you know, and then I started reflecting that even at work, people burn popcorn all the time. You can smell it flowing through the office pre-COVID. And so it was good to just sort of put it in the context of something that did go wrong, but everything was okay. And for me as a provider, I have to tell you, I was a little nervous because I was like, oh no, here I've been encouraging independence and risk and taking some chances that are sort of educated chances, but we still burned up a microwave. But it's good to remember that, you know, we all take risks in every part of our lives, and sometimes it goes well and sometimes it doesn't go well. But you sometimes do have to take those risks in order to create independence. And but anyway, I just wanted to just share that story with you, that, you know, it's something we just have to work with and balance all of the time.
Yep, absolutely. Okay, so now let's dive into those three wellness domains that are mentioned in the title of this session: physical, mental, and cognitive health. Let's start by talking about physical health. As a group, rare epilepsies can affect pretty much every body system, including the nervous system. And most of these systems are also susceptible to treatment side effects. What are some of the most common challenges you face when it comes to the impact of epilepsy and its treatment on physical health? And how have you addressed some of those challenges? Dr. Jones, do you want to start this time?
Sure. I think some of the challenges are with physical health is, you know, kind of even talking about a simple thing like exercise. So how much exercise is good exercise and how much is going to put a child or adult at risk, and so, you know, just trying to find that balance. I don't prescribe medication, so we, you know, we talk about how much the medications may be impacting things, how to balance, sort of balance the whole person, and keeping in mind that it's really important to pay attention to physical health and to take into all of those aspects of sleep and good diet, which I know we're going to talk about all of those things, but I think those are also a part of physical health.
Right. Dr. DeWoody.
Yeah. So once again, my daughter is pretty severely impacted with seizures and with clusters. Over the course of the years, we have used, you know, rescue meds hundreds of times. And so with regards to physical health, her epilepsies, that post-ictal state, the use of emergency meds, it is profound. She loses the ability to swallow, and that has impacted her nutrition, prompting us to have to get a G-tube when she was about 12 years old because we lost the ability to get good nutrition. And it makes this physical exercise a real challenge. So PT is prioritized above all other therapies in our house, because we realize if we're not constantly on this, that we might lose her motor ability, her ability to ambulate. And that is such a critical issue with quality of life. And we have to stay on that. And sometimes it's push, push, push to stay where you are. And so what that means is that when Marie is having good days, man, we have to take advantage of these good days. We have to push to maintain. We have to regain each time after these events. And so I can't emphasize enough how critical it is to kind of take advantage of good days, and how much medication will alter her ability to do things. So you talk about this, I'm going to go back to risk just a little bit, because you have to, because you can control seizures and have a very flat child, and you are not you're not able to then utilize physical health and emotional health and all of that. So epilepsy control at any cost is not a viable option within our community, within some communities. Okay, it's not, unfortunately, it's not a possibility right now. And so you have to weigh these other things: mental health, you have to weigh physical health, how much can you maintain, and just this fight to sometimes stay where you are and to make little incremental change, gains as you go along. So anyway, that's my perspective.
Yeah, that's the phrase you use, push to maintain. That is, it really encapsulates it in a way that I hadn't thought of before. So thank you for sharing that. Dr. Joshi.
So I'll just share a little bit on the catchphrase of impact of epilepsy and its treatment on physical health. I mean, there's no secrets that the treatment of epilepsy has impact on every aspect of physical health. Many of the children, particularly children with rare epilepsies, their condition is not just seizures or just intellectual disability, but it's really a multi-system process. And so when we talk about physical health and how epilepsy impacts treatment, how epilepsy treatment impacts physical health, the medicines we use, the treatments we use definitely impact other systems also. There are interactions between the medicines that we use for treating seizures and other medicines that are used. Some children who need medicines to help with some of the mental health comorbidities or attention to help them learn, we have to be sensitive to all the medicines and other physical conditions that are being treated. And at the same time, also balance what we are using to treat epilepsy to make sure that other treatments that are equally important are not left out. So another thing I'll say over here is, as we've talked about teams and risk and the impact of treatments, is engaging other doctors as part of the sort of care team, whether it's a gastroenterologist, because medicines that they use for absolutely essential conditions that some of these children have can have an impact on the treatments that are prescribed for epilepsy. If there is a child who absolutely needs to be on a medicine to help with attention and focus, that discussion must be had with the child's either primary care doctor or mental health provider, because that can be just as important as keeping seizures under control. As we said, there are lots of seizure medicines, and I will completely endorse what Dr. DeWoody said. We can use a lot of medicines to keep seizures under control, but then the outcome of that can be you have this. And if you want a child with quality of life where they are able to participate in school and other activities and what is important to them and their families, those conditions we must take into account when we use all our treatments. So that's my perspective.
Right. Okay, well, epilepsy increases the risk of depression, anxiety disorders, and other psychiatric comorbidities. These can be exacerbated by social isolation, stigma, bullying, restrictions and limitations, and of course, the unpredictability of seizures. What do you feel are some of the most effective strategies in terms of epilepsy care and mental health care and day-to-day living to support mental health for people with rare epilepsies? Dr. Jones, do you want to start with this one?
Sure. I think one of the most important things is regular screening. Just as we kind of talked about, it's important to revisit family goals over time, and then they fluctuate. mood and anxiety and attention can all also fluctuate over time. And then if there are stressors that come up in the family life or in the world in general, that all can trigger more depressive response or an anxiety response. So I think that's why regular screenings, it's good to have, and people checking in to make sure there aren't any new concerns, or if ongoing concerns are not being addressed, or the symptoms aren't going away. You know, I also think it's also good to look at mood, just as we were speaking a moment ago, in terms of changes in the medication regimen for epilepsy or the other conditions that are involved. So just sort of making that a part of the comprehensive overview of how the kid or the individual is doing, and just checking in and making mental health sort of the same priority as seizure frequency. Sort of putting it on an equal playing field. And I think in the field of epilepsy overall, we're getting better about looking at the comorbidities. I do think, you know, when you start to think about mood and treatment and adding another medication, sometimes parents are a little hesitant to think about, you know, should we add another medication to treat the depression or the anxiety? And that's certainly a worthwhile discussion to have and to think about the implications, but also not to be too fearful of trying something. I think it's sometimes if the mood and anxiety is impacting the kid's ability to be a kid, it's really important to think about putting another treatment on board to see if that helps. If it doesn't help, we can always sort of back up and try something else again. But sometimes I think it's really good to just try and see if it improves attention, for example, or if the kid's mood is down, it pulls them up so they can engage in other activities or in school or even socially. So I think, you know, sort of reviewing, checking, evaluating how the person is doing, and then also talking about treatment options is really important in the care of anybody with epilepsy.
Okay, Dr. Joshi.
I think to build on what Dr. Jones said, which is absolutely the incidence of all these mental health disorders are fairly high in individuals, children included, with epilepsy. And I think, again, I look at it as some of the effective strategies over here is this team approach. And also looking at, you know, where is the treatment and the intervention going to have, what kind of impact is that going to have? In Michigan, for those of you who are from Michigan will know that, you know, we have, particularly in the last year with the pandemic, there has been a profound impact on school for all children. But I think many of the children with special needs, including epilepsy, have been impacted in a very different way. And schools have opened up across the state, sort of in different stages, in different waves, in different sort of formats. And one of the things that I have become a little more sensitive about in my practice, whether it's seeing a child in clinic, whether I'm seeing a child on via a virtual visit, is to really ask about this social isolation in particular, because I think that has been something that has been really big in this last year. I'm really impressed with how many schools have tried to integrate children back into the classroom in small sizes, and what a challenge that is. But that really underscores the importance of how you know, our changing world and changing situations impact these. So, you know, again, talking to families more, bringing that out, engaging them, and encouraging them to seek whatever help they can get, whether it's, you know, through a community, through their primary care doctor, through through their epilepsy care team or other sources, I think is really important. And being sensitive to the fact that, especially right now with everything changing in a very different way, those needs also are going to change is also really important.
Right. Dr. DeWoody?
So I'm going, with regards to the really severely, profoundly affected, where your child is nonverbal, I'm just going to throw out a couple of different strategies. It's really hard for me to know the mental state of my daughter, who functionally is probably a toddler, if I'm really honest. And so how do we measure these things in these children? And so, what I'm going to say is journaling is so helpful. Okay. So we're all taught to keep track of seizures, and I hope everybody has a seizure diary. I think they're so important. But I would also emphasize, let's keep track of how often your child smiles, the number of good days that they have, because it is so easy with this incremental creep, especially when you try a new medicine, to just, you just lose little pieces of your child. And unless you're tracking this, it is very hard to kind of notice that. And sometimes it's almost somebody who comes in who hasn't seen your child in a little while, who comes in with a new perspective, because small changes are easy to miss. And so I just so much want to emphasize how important this keeping track of quality of life measures can really help the family make decisions on this. But also, I really want to bring in also the family in this case. And so I appreciate Dr. Jones and Joshi talking about the individual, but I want to open this conversation up just a little bit to the whole family. When my daughter first started having seizures, that first year and a half was brutal. And I remember, just silently kind of crying at a new cluster and having to give emergency meds and making the comment to my husband, I'll be so glad when I kind of get over this hump where I can deal with this, where it is not so emotionally draining. And he said to me, I hope that you never get to that point. And we were both right. Okay, we were both right, because you have to walk that line between not everything being a crisis and remaining completely empathetic to the situation. And that is a fine line that we ask caregivers to give on a daily basis. And so they need support on that and self-care on that to be able to not kind of fall off the edge in either direction. Okay, so it's like it's a line that you can fall off on both sides. And also, please be mindful of these siblings. So Taylor, my oldest daughter, said, you know what, when we came into this, you and Dad had 35 years of perspective when you started dealing with these crises, 35 years of kind of knowing that things ebb and flow and dealing with crisis management. But we came into this as children, bouncing from crisis to crisis with not much perspective. And that has a real impact that's actually been documented now. LGS and Dreve have both published really nice papers on this. So I just want to say, be mindful of the siblings and this, because depression and anxiety is so much higher in these siblings than it is in the average population. And so as we care for our families, please, let's care for our whole families. So counseling, screening of the siblings, it's so important. And let's not forget marriage counseling too, because this is tough on the parents, So just this whole idea of when we deal with this, that it's a family unit and everybody is struggling with these issues. And so self-care and maintenance is so important.
Right, really important points, thank you. The cognitive impact of rare epilepsies can vary widely across conditions and individuals, but for many it can be a primary challenge. Common impacts include intellectual disability, ADHD, memory problems, executive function disorder, slowed processing speed, and speech and language difficulties. In most cases, cognitive challenges consist of a combination of those things that are not likely to improve and others that are modifiable. Similarly, the management of cognitive difficulties often consists of a combination of compensatory strategies and efforts to directly improve modifiable cognitive functions. Can each of you share some of the more effective approaches with to coping with cognitive challenges on a day-to-day basis, and then also things that might actually improve cognitive function? Dr. Jones, do you want to start on this one?
Sure. Yeah, I think, knowing that cognitive function can be impacted by lots of different things. So sleep and stress and depression and anxiety. So sometimes if you see a change in people's or individuals' performance, I mean, you can even think about it in your own life, that if you're not sleeping well, if you've had disrupted sleep, that your attention and focus is not good, and you're trying to think about what you want to say and get the right words, and they're not coming out because you're just fatigued and tired. It's not, a permanent cognitive problem. So thinking about if there are other factors in the environment that are going on that could be negatively impacting cognitive performance is important, in trying to modify those things. Getting good sleep, getting regular sleep are really important things to do. I think in terms of interventions for cognitive challenges, I think the thing that is really helpful is to be creative. There isn't one thing that works for every person, and there isn't one thing that that I can say to do in a situation, and it's gonna be the key. And so sometimes I'll tell families, okay, let's try this. Let's look at setting up these reminders and cues in the environment and see how that helps. And then when they come back, I'll say, okay, what worked and what didn't work, and how can we modify it? And instead of thinking, well, you told me to do this and it didn't work, and we kind of give up and get frustrated. I think just remembering that, we may have to sort of flip things on their head once in a while, try things differently, try things that we hadn't thought of before, and see what works and what part works, doesn't, and the parts that don't work, throw them out and add in some other ideas. And I think that if we kind of know that going in, that this is a work in progress, and that I'm, want to challenge your creativity. And it's really important for me to know from the family's perspective what works and doesn't work. So I often meet with the significant others and the person with the epilepsy, and sort of see, how can we make it work? And they get frustrated with me because I'll say, well, why did it work? What made it work? So that if we can identify what those parts are, we can add them into the next intervention. So even back to the journaling, I think it's good to write those things down and kind of keep track of, what works, what doesn't work. And then we can kind of come together and see if we can come up with a plan and make it be more beneficial for everyone.
Great. Dr. DeWoody?
So, Maria has ring 14 syndrome. It's a large CNV, which is also what most large CNVs are highly associated with intellectual disability. So my perspective is, one, try everything. Augmented communicative devices, eye gaze, things like this, picture exchange programs. So try everything to try to get the most function out of your child, the most ability for them to have some kind of sense of identity and autonomy. This has to be consistent between your home life and your school life. So if there is no consistency in program, then this will not stick. So I would emphasize that. But also, I'm just going to bring this back to intelligence and ability in this realm is something that we all kind of want to take credit for. And this having this child and also having highly gifted children has really emphasized to me, you know, what a roll of the dice some of this stuff is, and how important it is to be gracious to people in their abilities and realize that these are in some part gifts. Now you can do with them what you want. And the reason I say this is because nobody judges my daughter harshly, because she is so far at the end of the spectrum. They are so nice and so sweet. But I think that these children who operate on this line of being almost, you know what I mean? They can be judged so harshly. And so I just want to say, can we just show them the same grace that we show people all over the spectrum? So you walk this line between wanting to push, and have people reach their full potential. I'm all for that. But let's not be disappointed. Let's not be, if that makes sense, okay? Because they didn't ask for these disabilities, you know what I mean? And so I'm just going to do a special shout out to those people who live just kind of in that gray area in between, because I think that they are the ones that are judged most harshly. But let's be consistent in the approaches that we deal with them to give them the highest advantage to succeed, if that makes sense.
Yeah, makes perfect sense. Thank you. Dr. Joshi, just briefly.
So I'll just be very quick, because I think both Dr. DeWoody and Dr. Jones have just highlighted some very key and important points and take-home messages for all of us. But again, I think here, when you have a child, a family, and a doctor who are all being team players in this situation, for I think one of the ways for a neurologist, an epileptologist, a primary care doctor to be an advocate for a child is to be supportive of the school program that they are in, to be cognizant of a child's abilities. And I think it's a celebration, what all our patients do. I mean, I am constantly impressed and amazed at everything the kids in my clinic do. And I think that it is a celebration. You know, how many times have I heard the story of a child with epilepsy and intellectual disabilities, a rare epilepsy? Oh, we were told you will never walk. And then, you know, does it not? I mean, this child was 5 years old when the child started walking. Hallelujah, somebody, you know. So I think those are moments to celebrate, because again, they're very empowering. It's very empowering when I come home at the end of the day and I have not made somebody's seizures better, but, you know, because of the care plan that we had, this child was able to enjoy a trip to Disney. And to see the smile on the child's face, it's so clear that they are there, and that's my reward at the end of the day. So I think I absolutely endorse everything that Dr. DeWoody and Dr. Jones said. I don't really have much to add there.
Great. Well, that's a great note to move on to our questions. We have several questions, so I'm going to try and get through as many of these as possible. And rather than have everyone respond, I'm going to have kind of first person to jump in. Let's see. Okay. Dr. DeWoody, as you were speaking about using rescue medications hundreds of times over the years, are there any long-term effects of those?
Oh, do I wish I knew the answer to that question. Right. And so I might ask Dr. Joshi or somebody who has really, I don't even know that there's been a ton of research on this, you know, evidence-based. What I will say is that I do not know my daughter off medication, and that the rescue medicines were necessary. And we had to do this. On the other hand, I will say that we try to minimize their use as much as possible. So we because that clearing your system of all of these meds is a process, and they have different half-lives, as we all know. And so we kind of alternate between drugs that have a short half-life to a long half-life to try to manage clusters so that we don't. And so I'm obviously speaking on the short term. So how do we maximize Marie's short-term health? But I have really no idea about the long-term effects, but they're necessary. They're necessary. So I wonder if Dr. Joshi has anything to add to that.
I'll add a little bit. So the medicines that are typically used for rescue therapy, as Dr. DeWoody said, they are necessary in the moment. One of the things that we do keep in mind is this group of drugs called benzodiazepines, which are the most commonly used group of drugs for rescue therapy, can over time produce kind of a desensitization or a tolerance effect. So one sort of long-term effect to just be aware of is being cognizant of their effectiveness and sometimes blunting of their effectiveness. And I think that's where, being, having that discussion about which situations do you actually intervene in, how do you intervene in. I have many families in whom they have more than one rescue medication for different types of seizures, where, and we set these goals and there's an or seizure action plan that looks same for 2 children. And I think that is exactly keeping in mind some of the things that Dr. DeWoody said.
Okay, and Dr. Joshi, I'll follow up with another question. How much is known about a vagus nerve stimulator possibly causing constipation, since the vagus nerve controls propulsive peristaltic waves in the intestines?
I don't know that there has been a lot of evidence-based research on that. The common things that we know of in terms of what the vagus nerve stimulation does is more related to effects on the larynx and on the voice from its effects on the recurrent laryngeal nerve. But yes, absolutely, there is the vagus nerve is a very active player in gastrointestinal motility and many other autonomic functions, but I don't think we have a definite answer on that one.
So maybe something that benefits from further research. Okay. Dr. Jones, how do I help my daughter retain information to be successful on a test? She has an IEP and it's hard to find a good study skill to help her pass a test. So I guess specifically thinking about like retention of information, the ability to both, intake information, retain it, and then recall it for tests. I guess you probably have to look at each of those steps, right?
Yeah, I think one of the things I always do is try to find ways for multiple presentations and then using multiple modalities to do that. So hearing it, seeing it, writing it, telling it back. And where that makes this hard is that school works at a certain pace, right? So there isn't always that time in the classroom to have those multiple types of presentations. And so that might be the way that you would supplement at home or with a tutor of, knowing that in class it's presented maybe 1 or 2 ways. So at home you present it in additional ways. And sometimes finding out, what is the stronger way for your child to sort of receive and encode the information and hold on to it. So some of us are visual learners, some of us are auditory learners, some of us have to be more active learners. And I think just knowing that it's going to take multiple presentations and multiple sort of being that back to the creative piece is like you're gonna have to be creative about how you are you presenting the information, having the child rehearse the information, give you the information back, but it's definitely going to take more than 1 or 2 presentations of the information.
Okay, well, we do have some additional questions, but luckily we do have an open forum, so we're just going to hold on to those for the open forum. So I want to thank all of our panelists for really an excellent and nuanced discussion of such a broad topic, and really appreciate your input and your thoughts on this.